Dr. Peter Stapleton here, clinical and health psychologist and associate professor at Bond University here in Queensland, Australia. And in my research career, I actually investigate the outcomes or effectiveness of EFT, emotional freedom techniques, or commonly known as tapping, for a range of different areas. We've spent many decades now investigating the impact for food cravings and emotional eating, particularly in overweight and obese adults. But we have recently been investigating the impact of EFT or tapping for things like chronic pain. So I want to talk to you today about an area of pain that we've particularly investigated because it had a two-prong approach. There have been some other pain studies, particularly in the area of fibromyalgia, as well as general pain, and I have included the references to those below in the show notes so that you can actually have a look at those if they're of interest to you. But for this particular study, I wanted to just outline for you very briefly what we did, just because aspects of it were quite surprising. So we actually were invited into a federal pain program here locally that wanted to include EFT in their 12-month pain program. So this was quite a unique invitation in that they were open-minded and obviously wanted to include complementary therapies such as tapping to help participants in the best way that they could approach and manage their pain levels just in life in general. So in this study we had two prongs. The first one we did an open-ended online investigation, and it was worldwide, where we asked people with chronic pain, and our definition of chronic pain is typically 6 months after any type of injury or the onset of pain occurred. 6 months is usually a time frame that's given for the body to have repaired itself, and if that was an injury, perhaps that's long enough that perhaps it is showing that the body should have repaired. Anything longer than that, we start to label it at a diagnostic level as chronic pain, in that maybe other factors are actually playing a role in the perception and perhaps the severity of pain that participants feel. So that was normally our definition. We weren't looking for acute pain or any type of injury that had happened most recently. So online, we actually asked participants anywhere in the world to give us their, exploration or their personal journey of what they had been through with pain. And we were able to ask them questions in that they could type as much as they liked in their responses so that they could feel heard. We were then able to take that data at a written level and analyse it through certain software. So we look for themes that stand out, and we look for percentages of, keywords that the same type of thing is being said by many, many people. And what really surprised us, or really stood out, was that worldwide across a range of different chronic pain areas, that 82% of our sample actually were indicating to us that the stigma they felt, particularly from health professionals, was profound. So that took me back a little bit in that we're supposed to be the people that are there to help assist them and to teach them different strategies to cope. And yet what they were reporting, 82% of them, was that they really felt stigma from the health professionals they were interacting with. The other thing that was really confronting, was that only 4% of the total sample told us they got any relief from psychological strategies. Now, we know in psychology we've a range of different tools that could be used in that chronic pain space, but a lot of people had explored many of these and only 4% said they got any relief. So again, they were all telling us those types of things, and it really shaped what we then did when we went in person and delivered an intensive EFT or tapping pain program for the group here locally. So that led us then to shape this program, and we went in, like I said, for an intensive. It was a 4-hour intensive program where for the first 2 hours we actually talked about what EFT was. We were able to demonstrate that. We used some common examples from the group, and all of them were tapping together. We were able to tell them about the trial that we'd done online and ask whether or not that was similar an experience for them, which of course they agreed. We then were able to find out some common themes from that group itself to find out what else was happening for them that they felt was impacting, or what did they need to help cope with their pain. So after that first hour, we were able to split the group, the larger group, into smaller groups of 3 or 4 participants. And in each of those little pods was an EFT trained practitioner or facilitator. And we were able to then spend 3 hours investigating with them in those small groups what the impact was for them individually. So they were able to then apply the tapping technique to their own personal individual cases. And we were able to use borrowed benefits, which I have outlined in another video what that means and why it's unique to EFT, so that all of them got a chance to do tapping, but at the same time they were benefiting from watching someone else in their pair or trio do tapping as well. So the biggest things that we were noticing, and we obviously got their feedback at the end of that group, they were able to fill out questionnaires, and also 6 months later, was that during that particular day themselves, they were describing not only a significant decrease in the severity and impact of their physical pain, because they had that then and there and they could feel it, but they were able to describe a sudden decrease as well, and it was statistically significant, in things like how depressed they felt, any other psychological distress or stress that they felt about their future, that type of thing. And if I just refer to my notes here, just because some of these statistics are quite significant, that the decrease over that day in their psychological distress was 37%. In their anxiety, it was nearly 42%. Their stress levels, it was nearly 39%. Their depression levels dropped by 30% just over that 4 hours. We then followed them up 6 months later, like I said, and those effects were maintained over time. So that was a good outcome for us, and it was certainly the first bit where we'd ever come into the chronic pain space with EFT to run a clinical trial. But it is an area that we want to investigate in the next several years moving forward from 2019. So it is something that I would definitely explore, that if you've had chronic pain yourself, even though there's only 3 or 4 published clinical trials, there are hundreds of case studies of practitioners and experts that have actually used EFT for chronic pain. So some websites are below if you want to explore individual case studies. Certainly have a look at the research that's published to date, but also watch this space of what we're able to achieve in the next several years, because we will be looking at this more at an evidence-based level in the years to come. So I'm Dr. Peta Stapleton. Thank you for listening, and I look forward to joining you again in another YouTube series.